all. Today's topic is Kanda Rogas. As you know, Kanda Pradesha is the neck region. So neck region, the diseases coming in the neck region or the throat region is known as Kanda Rogas. So first we will see the enumeration that is mentioned in Susra Samhita. Kandagadastu Rohinyaha Panja Kandashalukam Adijihvu Valayo Balasa Ekavrindo Vrindaha Shadakni Gilayu Galavidradi Galaukha Swarakno Mamsatano Vidarischa iti. So these are the Kanda Rogas mentioned in Susra Samhita. So Kandagadastu Rohinyaha Pancha, 5 types of Rohini, Kandashalukam, Adijihva, Valaya, Balasa, Ekavrinda Vrinda, Shadagini, Gilayu, Galavidradi, Galaugha, Swaragno, Mamsatano, Vidari, Cha iti. So now we'll see which all diseases are mentioned in Ashtanga Hridaya and what is the difference between Ashtanga Hridaya and Susra Samhita in case of enumeration. So in Ashtanga Hridaya, Acharya mentioned 18 types of Kanda Roga, and in Susra Samhita, Susratacharya mentioned 17 types of Kanda Rogas. So Ashtanga Hridaya also and Susra Samhita also, Rohini, Acharyas mentioned 5 types, that is Vataja Rohini, Pittaja Rohini, Kabaja Rohini, Rektaja Rohini and Sannipadaja Rohini. Same only is mentioned in Susra Samhita also. Kandashaluga, that is also mentioned, Vrinda, and in Ashtanga Hridaya, Eka Vrinda is also added. So Vrinda and Eka Vrinda, but it is counted as one disease. Tundigeri is mentioned in Kanda Rogas in Ashtanga Hridaya, but in Susra Samhita, as you all know, it is mentioned in Talugada Rogas. Galaukha, that is mentioned in Susra Samhita also. Valaya, that is also mentioned in both the Samhitas. Gilayuka, Shadagni, Galavidradi, all these diseases are mentioned in Susra Samhita also. And extra diseases that is mentioned in Ashtanga Hridaya are Gala Arbuda, then Galagandas, 3 types of Galagandas, that is Vadaja, Kapaja and Medoja, that is not mentioned in Susra Samhita. And Swarakna is mentioned in Susra Samhita. And extra diseases mentioned in Susra Samhita in Kandagada Rogas are Adijihva, Balamsa, Mamsatana and Vidari. So this is the difference of opinion in Ashtanga Hridaya and Susra Samhita about the diseases of Kanda. So Vadaja Rohini, that is mentioned in both Susra Samhita and Ashtanga Hridaya. Kandashalugam, Vrinda, Galauga, Valaya, Gilayuga, Shadagni, Galavidradi and Swarakna. All these are common in both the Samhitas, but in Ashtanga Hridaya, the extra mentioned diseases are Tundigeri, Gala Arbuda, Vadaja Galaganda, Kabaja Galaganda and Medoja Galaganda. In Susra Samhita, along with Vrinda, Eka Vrinda is also mentioned, and Adijihva is mentioned in Jihva Roga, under Jihva Roga in Ashtanga Hridaya, but it is mentioned in Kanda Rogas in Susra Samhita. Balasa, Mamsa, Dana and Vidari are extra diseases mentioned in Susra Samhita. So this is about the enumeration of Kanda Rogas. Next, we will go into detail description about each diseases. First one is Rohini. So Rohini, as we saw, there are 5 types of Rohini: Vadaja, Kabaja, Pittaja, Rektaja and Sannipadaja. Before that, Acharya had mentioned a Samanya Lakshana for a Rohini, and Rohini is compared with diphtheria. And the main thing is, it will, you can see in this picture, it will block the throat. Jihva, see the Lakshana. Jihva Prabandhaja Kanthe Daruna Margarudinaha Mamsanguraha Shikraschaya Rohini Shikrakarini. Jihva Prabandhaja Kanthe Daruna Margarudinaha. So Kanthe, in Kanda Pradeshe, Mamsa Angura will form. Mamsa Angura is forming where Jihva Mulasto, at the end of the tongue in the neck region, there is a Mamsa Anguraha, the muscular growth. Daruna Margarodinaha, Daruna Dussaha Margarodinaha, it will obstruct the path of also Shikraschaya, it will form very fast. Rohini Shikrakarini, and it is Ashukari. So Rohinim Shikrakarini, it is very fast. It will it will form that a disease, and it will go to the next stages also very fast. So we should be careful, and we should do the treatment as soon as possible, otherwise it can even cause death of the patient. So this Rohini is a very very dangerous disease, so we should treat it as soon as possible. So the Samanya Lakshana is Jihva Prabandhaja Kande, Jihva Mula, and the area where there is the Jihva ends, that is Jihva Mula, in the neck region, there will be formation of small mamsa anguraha will be forming, and it will cause the obstruction and also dussaha. It's very difficult and it's very painful. Shikrashchaya, it will chaya, it will very fast, it will proceed, and even it can cause death of the patient. So this is according to Ashtanga Hridaya. According to Sushruta Samhita, Gale Anilaha Pitta Kafauscha Murchidau Pridak Samastascha Stadeva Shonidam Pradushya Mamsam Galarodino Anguran Srijandi Yan Sa Asuhara Hi Rohini. Same. So Gale Anilaha Pitta Kafauscha Murchidau. So in Gala Pradesha, Anila Pitta Kafa Cha Murchidau Pradak Samastascha. Anila, that is Vada, Pitta and Kapha will get vitiated in neck region or throat region. Pridak Samastascha, sometimes how individually, separately or together, like Tridosha. Tadeva Shonidam, also there will be Shonidam, Rekta Dushti will also be there. So this is a Sannipadaja condition. So in Gala region, due to the vitiation of Vada, Pitta, Kapha and Rekta, independently or together, it will cause Rohini. Pradushya Mamsam, it will cause vitiation of the Mamsa also, and cause Gala Rodino, it will cause obstruction of the neck. Anguran, what will cause obstruction? Anguran, small muscular growth will cause the obstruction. Srijandi Yan Isa Asuharahi Rohini, and it will cause even Asuharahi Rohini. So this disease is known as Rohini, and it can even cause the death of the patient. So it will spread fast. It will go to the next stages fast, and it can even cause the death of the patient. So this condition can be compared to diphtheria. So this is according to Susra Samhita. So here all the Tridoshas are getting vitiated, and it will cause Mamsa Ankura, and that will obstruct the neck region. This is the Samanya Lakshana of Rohini. Next, each one we can see now. So first one is Vadaja Rohini. Kanda Asya Shoshakrit Vadat Sahanusrotra Rukkari. Kanda Asya Shoshakrit Vadat Sahanusrotra Rukkari. So Vadaja Rohini. Sa, that is Rohini. Because of the vitiation of Vada, if it is causing Rohini, then the Lakshanas are Kanda Asya Shosham. There will be dryness in the Kanda region and Asya region, neck and mouth. There will be Shosham, there will be dryness. Hanusrotra Rukkari, and there will be pain in Hanu region and Srotra. Hanu means the jaw region, and also in the Srotra, in the ear also there will be pain. That is the Vadaja Rohini Lakshana according to Ashtanga Hridaya. So Kanda Asya Shosham, there will be dryness in Kanda and Asya region, and there will be pain in Hanu and Srotra region. According to Susra Samhita, Jihvam Samanthat Prishavedanaye Mamsankura Kanda Nirodinaha Syuhu Tam Rohini Vadakridam Vadanti Vadat Kobadravagada Vadatmaga Ubadrava Gada Yukta. So Jihvam Samanthat Prishavedanaye Mamsanguraha Kanda Nirodina Syuhu. Like we mentioned, Jihwam Samantad Prishavedanaye Mamsa Anguraha. There will be formation of Mamsa Anguras in the end of the Jihwa, and it will cause the obstruction and there will be severe pain in that region. Tam Rohini Vada Kradam Vadandi. That Rohini is caused by Vada, and that is known as Vadacha Rohini, Vadatmaka Ubadrava Gada Yukta, and there will be complications, secondary diseases caused by Vada will be severe. So Vadatmaka Ubadrava, so there will be complications. Gada Yuktam, that will be severely affecting. So that is according to Susruta Samhita. So in Vadacha Rohini, you can see all the Vada Lakshanas. Shosha will be there and pain will be there. Which all regions we have to, the Acharya specify. And as Rohini, it will cause the obstruction of the throat. So first we will discuss about the Samanya Chikilsa for all the Rohinis and then the Vadacha. So Samanya Chikilsa Kantha Rogeshu Asrik Moksha Tishnehi Nasyadi Karmascha. In all the Kanta Rogas, we can go for Asrik Moksha. That is, Rekta Mokshana can be done. Tishnehi Nasyadi Karmascha. Tishnehi Tishna Nasyadi. So Nasya, Gandusha, Kabala, everything can be done with the Tishna Dravyas. So that is the Samanya Chikilsa. Kwadaha Panam Cha. Kwada Panam. So Kashaya Panam can be given with Darvi Twak Nimba Tarsha Kalinga Jaha. So we can give Kashaya for drinking prepared with Darvi Twak, Nimba, Tarsha and Kalingaja. Haridagi Kashayo Va. So Haridagi Kashaya can also be given Va Peyo or Peyo Makshika Samyudam. So we can give two Kashayas. Here Acharya mentioned two Kashayas. First one is Darvi Twak Nimba Tarsha Kalingaja Kashaya can be given, or Haridagi Kashaya can be given, and it can be mixed with the honey and Makshika Samyudaha. So first Acharya mentioned we have to do Rekta Moksha, then you have to go for Tishna Nasyadi Karmaha, then you can give Kashaya for Panam, that should be Darvyadi Kashaya or Haridagi Kashaya can be given along with the honey, Makshika Samyuda. Shreshta Vyosha Evakshara Darvi Dubi Rasanjanaihi Sapada Tejini Nimbaihi Sukta Gomutra Sadidaihi Kabalau Gudika Va Atra Kalpida Pradi Saranam. So with all this drug we have to make Kashaya and we can give for Kabala, and also the same yoga we can use for preparing Gudika, and that can be used for Pradi Sarana. So Sreshtadi Yogam. So Sreshta Vyosaya Vakshara Darvi Dvibi Rasanjanehi Sapada Tejini Nimbehi Sukta Gomutra Sadidehi Kapalo. With this you have to make a Kashaya and given for Kapala, and with all these drugs you can make a Gudika, and that can be given for Pradi Sarana. Nijulam Kadampi Mustam Devadaru Mahaushadam Vajadandischa Murva Cha Lebaha Koshno Arti Shofaha. Nijulam Kadapi Mustam Devadaru Mahaushadam Vajadandischa Murvascha Lebaha Koshno Artir Shofaha. If there is pain and there is swelling, you can give Lebana. Leba can be applied. Koshno, little with a warm leba can be given if there is pain and edema. So these medicine should be used. Nijulam Kadapi Mustam Devadaru Mahaushadam Vaja Dandischa Murva. All this can be made into a paste and a little warm you have to apply in the area where there is pain and edema. So this is the Samanya Chikilsa of all the Kanta Rogas. Next, this is the Chikilsa for Rohini. So Vadaja Rohini Chikilsa, specific treatment. This is the slogan mentioned in Ashtanga Hridaya. Atha Andarbahyadah Svinnam Vadarohinikam Likhed Anguli Shastrakena Ashu Padiyukta Nakhenava Panjamulambu Kavala Stylam Gandusha Navanam. So Atha Andarbahyadah Svinnam Vadarohinikam Likhed Anguli Shastragena Ashu Paduyukta Nakhenava. So Atha Andarbahyadah. Inside also you have to give Svedana and outside also you have to give Svedana. After that, Lekhana should be done using Anguli Shastra. Anguli Shastra or Padiyukta Nakhenava. Or in the Nakha you have to put sign the one Lavana, Padu's Lavana, Paduyukta Nakhenava. With your hand only you can do Lekhana. Panchamula Ambu Kapala Stylam Gandusha Navanam. Panchamula Ambu, using the Panchamulas, Brihat Panchamulas, you can give Kapala for the patient, and Thailam Gandusha Navanam. Thailam can be given for Gandusha and Navana. This is according to Ashtanga Hridaya. So you have to give Svedana both inside and outside. Then you have to do Lekhana using Angli Shastra or using your Nakha, which is filled with the Padu, Lavana. And that after that Lekhana you have to give Kabala with the Panchamula Kashaya, and also Gandusha and Navana can be given using Thailam. So this is the Chikilsa mentioned in Ashtanga Hridaya. According to Susra Samhita, Sadhyanam Rohinim tu Hidam Rohini Shonida Mokshanam Chardanam Dhumapanam cha Gandusho Nasya Karmascha Vadagim tu Hride Rekte Lavanehi Pradisarayet. Sadhyanam Rohininam tu Hidam Shonida Mokshanam. So Rohini can be Sadhyanam Rohini to Hidam Shonida Mokshanam. So which can be treated, can be first should be given Shonida Mokshanam. So Rekta Moksha should be done. Then Chardanam Duma Chanam cha Gandusho Nasya Karmascha. Then Vamana Dhumapana Gandusham and Nasya Karma can be given. Vadagim tu Hride Rikte Lavanehi Pradisaranam. In Vadaja Rohini you can do Rekta Moksha. After that you have to do Pradisarana using Lavana. So this is according to Susra Samhita. So in here Acharya mentioned the Samanya Chikilsa given in to be given in Rohini along with the Vadika Rohini Chikilsa. Next comes Pittaja Rohini. So first the Lakshana mentioned in Ashtanga Hridaya. Pittadjvara Osha Trin Moha Kanda Dhumayanan Vida Shipraja Shiprabaga Adhiragini Sparshana Saha. Pittad, in Pittaja Rohini there will be Jara, Osha, Trishna, Moha, Kanda Dhumayanan Vidaha. The patient will feels like a Dhuma is coming out of his mouth. Kanda Dhumayana, from the throat. So fumes are coming out of the throat, like that it will be burning. Shipraja, Shiprapaga, and it is very fast, and Shiprapaga will also quickly it will go to the Paga Avastha, and Adhiragini it will be very reddish. Adhiragini Sparshana Asaha, and there will be severe tenderness. The patient won't allow us to touch that area. So that is the Pittaja Rohini Lakshana. Pittat, Jvara, Osha, Trishna, Trin, Moha, and Kanda Dhumayanan Vidaha. In the Kanda Pradesha, there will be, the patient will feels like fumes are coming out. Shipraja, Shiprapagascha. Very fast there will be Pakwa. It will go into the separation stage, and it will be dark red. Adhiragini. The throat will be full red in color, and Sparshana Asaha. There will be tenderness. According to Susra Samhita, Shiprodgama, Shipra Vidaha, Shipra Vidaha Paga, Tivra Jvara Pitta Nimittaja Syat. So it will form very fast. Shipra Udgama. So formation also fast, and Paga also will be fast, and there will be Daha and Tivra Jvara. There will be fever because of this Pittaja Rohini. This is according to Susrata Samhita. These are the Lakshanas mentioned in Ashtanga Hridaya and Susra Samhita. Next comes the Chikilsa for Pittaja Rohini, Visravya, Pitta Sampudam, Sita Kshaudra, Priyangubihi, Karshet Roda Patanga, Rodra Patanga. Karshet Rodra Patangehi, Kapalaha Kvadidescha Taihi, Draksha, Parushaga Kvadhu, Hidascha Kabala Grehe. So Visravya Pitta Sampudam, Sidak Shaudra Priyangubihi, Karshet Rodra Patangehi, Kabalaha Kvadidescha Taihi. So Visravya Rektamoksha can be done. After that you have to do Karshana or Pradisarana using Sidak, Shaudra, Priyanku, Rodra, Patanga. You can make a Kashaya of these Ravyas and can also do Kabala. Also one more yoga for Kabala is Draksha, Parushaka, Kwado, Hidascha Kabala Grehe. We can use Draksha and Parushaka and prepare Kwada and you can do Kabala using this also. So first you have to do Rektamoksha. After that you have to go for Karshana or Pradisarana using Sidak, Shaudra, Priyanku, Rodra and Patanga. Also with these drugs you can make Kashaya and given for Kabala, and other Kabala yoga is Draksha and Parushaka Kwada. Using that also you can do Kabala. According to Susra Samhita, Patanga Sharkara Kshaudrehi Paitikim Pradisaraye Draksha Paryushaka Kwadohi Dascha Kabala Grehe. So here also for Pradisarana, Patanga Sharkara and Shaudra can be used, and for the Kabala, Draksha Paryushaka Kwada can be used. Next comes Kabaja Rohini Lakshana, Kapena, Pichila, Panduhu. So Kabaja also the Rohini Samani Lakshana will be there. There will be Mamsangura, it will be blocking the throat, but that will be Pichila in Kabaja. If it is caused by Kabadosha, then the Mamsangura will be Pichila, slimy, and Pandura, white in color. So that is according to Ashtanga Hridaya. According to Susra Samhita, Srodo Nirudinyapi Mandapaga Kurbim Stirasa Kaba Sampava Vaihete. Samanya Kabaja Lakshanas like Srodo Nirodhinyapi. So it is causing the obstruction of the throat. Again, there will be Mandapaga. The Paga will be slow. Guru, the heaviness will be there. Stira. It will be Stira, the Mamsanguras, Sakaba Sampava Vaihi. That is how the Kabaja Rohini looks like. So this is the Kabaja Rohini Lakshana. So it will be white in color and the sliminess, Pichila, will be there. Next, the treatment of Kabaja Rohini. Sa agara dhumehi sagara dhumehi kadugehi kabajam pradisarayed nasya gandushayo stylam sadidam cha prashasyade apamarga phalakshveda dandi jandukne saindavehi. So sagara dhumehi kadugehi kabajam pradisarayed. So sa agara dhumehi means the from the house, what we are taking from the walls, that from the dhuma, in olden house and all, the walls of the kitchen will be dark in color, right? So you have to take that one, that and along with kadukeihi you have to do pradisaranam in Kabaja Rohini. Nasya gandushayo stylam. For Nasya and Gandusha, you have to prepare Taila Sadidamcha Prashasyade using the given drugs. So Nasya and Gandusha should be done with the Taila prepared with Apamarga, Phalakshveda, then the Jandukna Saindavaihi. Using these dravyas, you have to prepare Taila and you can use that for Nasya and Gandusha. So Pradisaranam, Agara Dhumaihi from the Agara Dhuma and Kadugehi, you have to do Pradisaranam, and Nasya Gandusha, the Taila prepared with these drugs. So Apamarga, Phalashveda, Dandi, Jandukna, Saindava, with all these things you have to prepare Taila and use for Nasya and Gandusha in Kabaja Rohini condition. So in Susra Samhita also same, Agara Dhuma Kadugehi, Slaishmige Pradisaranam, Shveda Vedanga Dandishu, Tailam Siddham Saindavam, Nasya Karmani, Yoktavyam Tada Kabala Dharanehi. Here instead of Gandusha, Acharya mentioned Kabala should be done using this Taila. So same treatment is mentioned in Susra Samhita also. Next comes Rektaja Rohini, Asraja Spodagas Chida tapta angara nipha karna rukkari pittaja kritihi. Asrija spodagas chita. So you can see small vesicles, spodagas. So in Asrija Rektaja Rohini there will be formation of small vesicles. Tapta Angara Nipha Karna Yukkari, and it looks like the Tapta Angara Nipha, red hot coal, like Tapta Angara Nipha and Karna Rukkari, Pitta Jakratihi, Karna Rukkari, there will be pain in the Karna ear, and Pitta Jagratihi, and all the lakshanas of Pitta can also seen in Rektaja Rohini. There will be Jwara, Trishna, Osha, and all. So same Pittaja lakshanas can be seen in Rektaja Rohini. Along with that there will be small vesicles, and also Tapta Angara Nipha, it looks like a and the patient also feels like a red hot coal inside his throat, and there will be severe pain in the Karna region. This is according to Ashtanga Hridaya. According to Susruta Samhita, Spodaschida Pitta Samana Lingam Asadhya Pradishta Rudiran Mikenyam. So this is Asadhya disease, and there will be vesicle formation. Spodaschida Pitta Samana Linga can be given, and this is known as Pittaja. The Pittaja lakshanas can be seen, and this is Rektaja Rohini. So there will be spoda, and it is an Asadhya Vyadhi according to Susruta Samhita. The treatment, Upachare devameva pratyakhyayam asra sambhavam. So like the Pittaja Rohini Chikilsa, you can do Rektaja Rohini Chikilsa also. According to Susruta Samhita, Pittavat sadayed vaidyo Rohinim Rekta sambhavam. So like the Pittaja only sadayed vaidyo, Pittaja Rohini Chikilsa can be done in Rektaja Rohini also. Next comes Sannipadaja Rohini. So all the three doshas involved. So all the lakshanas can be seen here. Gambira Paga Nijayat Sarvalinga Samanvida. So Gambira Paga Nijayat. So Nijayat means Sannipadat. So Gambira Paga. There will be Gambira Paga. There will be a full separation will be there. Gambhira Paga Nijaya Sarvalinga Samanvida. So all the lakshanas can be seen in Sannipadaja Rohini. Gambhira Paga Apradivara Virya Tridosha Linga Traya Sambhava Syat. So here also same Acharya Susra is mentioning Gambhira Paga will be there. Apradivara Virya. So treatment is not mentioned. It's a Asadhya Vyadhi. Tridosha Lingam Traya Sambhava Syat. So all the doshas, three doshas are involved. So all the three doshas, lakshanas can be seen. So that is Sannipadaja Rohini. That is about the lakshanas, all the lakshanas, Samanya lakshanas and individual lakshanas of Rohini along with its treatment. Next comes Kanda Shaluka. So Kanda Shaluka can be compared with the adenoiditis. So adenoids, you know, so the enlargement or hypertrophy of adenoids can be compared to Kanda Shalukam. Doshaihi kafolbanaihi chofaha kolavad gradita unnadaha shuga kandhagavad kandhe shalugo marga rodinaha. So this will also cause obstruction in the neck region. So doshaihi kafolbanaihi shofaha kolavad gradita unnaha. Doshaihi, so vadadibihi, so all the doshas are involved. Tridosha visheshan will be there. Kabolbanaihi, in that more predominantly kapaja visheshan will be there. Shofa is formed. Shofaha, the shofa looks like kolavad. The size of the shofa is kolavad. So like kola pramanam. So that much size. Kola phala. The size of the kola phala. Gradida unnadaha. So there will be a swelling. Shuga kandhagavat kande. So shuga kandhagavat, like a pricking, like a it is having thorns. Kandhagavat kande shalugo. That disease is known as Kanda Shaluga Marga Rodanaha. It will obstruct the passage. So it will obstruct the neck. So Kandashaluga is formed with by the vitiation of all the three diseases, and there will be swelling. That swelling will be a big swelling. Gradida unnadaha, that is the size of the kola phala, and it will be having thorns. It will prick like thorns, and also it will obstruct the passage. So this disease is known as Kanda Shalugam. This is according to Ashtanga Hridaya. Next comes Susru Samhita. Kolasti matra kapasambhavoyu grandhir gale kandaga shuga pudaha swa kharaha stiraha shastra nipada sadhyastam Kanda Shalugam idi Bruvandi. So kola asti matra kapha sambhavoyo. It is the kola asti matra. So kola kola phala asti. So the seed of it is in the size of the seed of kola phala. Kapha sambhavayo yo. So this is caused by Kafacha according to Susru Samhita. Grandhir Gale. So there is a formation of Grandhi in the Gala Pradesha. Kandaga Shuga Budaha. Kandaga means it's thorn like. So Jihwa Kandaga and all we mentioned like. So we learned. So Kandaga is like thorn like. Shuga Pukaha. It will be pricking like thorns. Kharaha. So rough. Stiraha. In one place only. It is static. Shastra Nipada Sadhyastam. So this is a Shastra Sadhya disease. Kanda Shalugam idi Bruvandi. That disease is known as Kanda Shalugam. So this is the Lakshanas of Kanda Shaluga according to Ashtanga Hridaya and Susru Samhita. Chikilsa, all the Chikilsas are mentioned in Ashtanga Hridaya together. So this is according to Susruta Samhita, this treatment, this sloka, Visravya Kanda Shalugam Sadaye Tundigerivat Eka Kalam Yavannam Cha Bunchita Snigdam Alpashaha. So Visravya, Rekta Moksha can be done, Sadaye Tundigerivat, and Tundigeri Chikilsa can be done, Eka Kalam Yavannam Cha Bunchita Snigdam Alpashaha. And one time you have to do Yavan, you have to eat Yavanna prepared with Snigdam Alpashaha. After adding Sneha, you can have Yava Annam. So this is the Kanda Shaluga Chikilsa according to Susru Samhita, and Tundigeri Chikilsa is mentioned in Talugada Rogas in Susruta Samhita. Next disease is Vrinda. So Vrinda and Eka Vrinda is mentioned together in Susru Samhita, and in Ashtanga Hridaya only Vrinda is mentioned. Vrindo, Vritto Nado, Daha Jvarakrit Gala Parshvekaha. So Vrindo, Vritta Unnado. So Vrinda is a condition, there is a in the Gala Parshva, there will be a shofa which is round in shape and unnadaha, raised. Daha Jvarakrit Gala Parshvakaha, and there will be Daha, burning sensation, and Jvara, rise in temperature, Gala Parshvakaha, and it is formed in the side of the throat. So that is according to Ashtanga Hridaya. So Vrinda is a disease which will cause a shofa in the side of the neck region, which is round in shape, and along with that there will be burning sensation, Daha and Jvara. According to Susruta Samhita, Susrutacharya mentioned Vrinda and Eka Vrinda. So Vrittonnado Yaha Swayaduhu Sataha Kandwan Vido Apakya Mridu Guruscha Namna Eka Vrindaha Parikirtito Asau Vyadar Balasak Shadaja Prasudaha. So this is the Lakshana for Vrinda, and this is the Lakshana for Eka Vrinda, and this Samunnadam Vrittam Andam Daham Tivra Jvaram Vrindam Udaharanti. This is the Lakshana for Vrinda. Tamcha Abhi Pittak Shadaja Pragobad Vidya Satodam Pavana Asrajam tu. So Vrittonadam Yahak Shvayadu, Vrittonnadam, so round in shape, Unnada Shvayadu, Shofa will be there. Along with that there will be Daha, Kandu also, Kandwa and Vido, Apakya, there won't be any Paga, Mridu Guru, and soft and Guru, Namne Eka Vrindam. That Shofa is known as Eka Vrinda Parikirtido Aso Vyadar Balaksha Shadaja Prasudaha. So this Vyadar Vyadi is because of Balasa. Balasa means Kapha and Shadaja, Rekta. So here the main doshas which is causing Ekavranda is Kapha and Rekta. So there will be Ekshvayadu, Shofa, which is round in shape, and Unnada. There will be Daham, Kandu, and Paga won't be there, and Mridu, Guru, that swelling is Mridu, soft, and Guru, heaviness will be there. That disease is known as Ekavranda and it is caused by Kapha and Rekta. Next, Vrinda Lakshana, Samunnadam Vrittam Mandadaham. This is also round shaped swelling which is having Mandadaham. There will be slight Daha burning sensation, Tivra Jwaram, and Vrindam Udaharandi. That disease is known as Vrinda Tamcha Abhi Pittakshadaja Pragobad. That is, this Lakshanas is when the Vrinda is caused by Pitta and Rekta. Pittakshadaja Pragobad Vidyat Satodam Pavana Asrajam tu. If it is caused by Vada and Rekta, then there will be pain also. Satodam Pavana Asrajam tu. So this is according to Vrinda. So Vrinda can be caused by Pitta and Rekta and also by Vada and Rekta. So if it is caused by Pitta and Rekta, then there will be, the swelling will be having Mandadaha and Tivra Jwara. And if it is caused by Pavana, Vada, then there will be pain. So this is the Lakshana of Ekavranda and Vrinda according to Susruta Samhita. The Chigilsa Ekavrandam tu Visravya Vidim Shodanam Acharet. So this is according to Susruta Samhita. So Vrinda is Asadhya Vyadi. So Ekavranda can be done Visravya. You can do Rekta Moshana and Shodanam Acharet Vidim. So according to the condition, you have to do Shodhana. Next comes Tundigeri. It is only mentioned in Ashtanga and Kanda Rogas. In Susra Samhita, it is mentioned under Talugada Rogas. Hanu Sandhyasritaha Kande Karpasi Palasannibaha Pichilo Mandarukshofaha Kadinas Tundigerika. So Hanu Sandhi Asradaha, the junction, the joint where the Hanu and Kanda joins, that end. Hanu Sandhi Asradaha Kande Karpasi Phala Sannibaha. It looks like a Karpasi Phalam. Karpasi Phala Sannibaha Pichilo Mandarukshofaha. There is a swelling. That is, sliminess will be there, and Mandarukha, slight pain will also be there. Kadina, and it will be hard. That is known as Tundikeri. So Tundikeri is a swelling seen in the end where the Hanusandhi ends. There you can see a swelling which is hard and slimy, and also there will be a slight pain, and it looks like Karpasi Phala. That condition is known as Tundikeri, and we can compare this with tonsillitis. So Chigilsa Tadvasya Vrinda Shaluga Tundikeri Gilayushu. So Kabaja Rohini Chigilsa Tadvasya. So Kabaja Rohini Chigilsa can be done in Vrinda, Kanda Shaluga, Tundikeri and Gilayu. So this is what mentioned by Ashtanga Hridaya. So in Ashtanga Hridaya, the Chigilsa for are same for Kabaja Rohini, Vrinda, Shaluga, Tundigeri and Gilayu. Next is Galaukha. Bhakya Andaha Kshvayadur Khoro Galamarga Galopamaha Galaugho Murtha Gurudva Tantra Lala Jwara Prataha. So Bahya Andaha Kshvayadu. This is according to Ashtanga. So there will be Shofa or Shvayadu. Shvayadu edema will be there, Bahya and Andaha. So outside also there will be swelling, inside also there will be swelling. Gala Marga Galopamaha. In Gala Marga you can see another Gala. Because of the swelling you can see the throat is filled with another throat is completely filled with something. So that is why it is known as Galaukha. Galaukaha, that condition is known as Galaukha. Murtha Guruda, there will be heaviness in the head, Tantra, Lalasrava and Jwara. So this can be compared to retropharyngeal abscess, or this will be abscess, the formation of abscess in the throat region. We can compare that with retropharyngeal abscess. There you can see outside also there will be swelling, and inside the throat also there will be swelling. So outside and inside there will be swelling, and it will completely block the throat, and along with that there will be heaviness in the head, and there will be Tantra, and Lalasrava will be there, and Jwara will also be there. This is according to Ashtanga Hridaya. According to Susra Samhita, Shofo Mahan Anna Jala Ubarudi Tivrachveru Vada Gede Nirhanti Kapena Jadu Rudran Videna Gale Galauka Parikirtyedo Asau. Shofo, there will be a Mahan Shofo, that is a big swelling that will block Anna Jala Avarodi, that will block the passage of Anna, Ahara and Jala through the throat, and there will be Tivra Jwara, severe fever will also be there, Vada Gade Nirhandi, and even the Vada Gadi will get obstructed. That means air, breathing, air should also be get stopped. Kaphena Jadu Rudiran Videna. So this is a disease caused by the vitiation of kapha and rekta in the gala region, Galaukha Parikirtido. So this disease is known as Galaukha. So according to Susra Samhita, there will be a big swelling which will cause the obstruction of ahara, jala, water and also air to pass through the throat, and it is caused by kapha along with the rekta. So this is the Lakshana of Galaukha, and Galauka is Asadhya Vyadhi. So the treatment is not mentioned. Next comes the Valaya. Valayam na adiruk shofas tadvad eva ayatana unnataha. So Valaya na adiruk. Valaya is, this is according to Ashtanga Hridaya. In Valaya there won't be any pain. Na adiruk shofas tadvad eva ayatana unnataha. So ayatana and unnataha, there will be shofa. Shopa will be long and up. Ayatana unnadaha. So that disease is known as Valaya. There will be shofa. All these are swellings in the throat, in maybe abscess or any benign or a malignant growth. So because of that there will be maybe we can compare with all those things, cyst or any abscess then there will be fever. And also any malignant growth can also be compared with all these things. The shape is ayatana unnadaha. It is long and raised. So valayam na adiruk, there won't be any pain also. According to Susra Samhita, balasa eva ayata munnadam cha shofam karodi annagadarm nirvarya tam sarved eva apradivarya viryam Vivarjaniyam Valayam Vadanti. So that is a Asadhya disease. Valasa means kapha. Eva ayatana unnatam cha shofa. Kapha is causing a shofa which is ayatam unnatam. So long and raised. Karodi annagadim nirvarya, and it will block the ahara to pass through the esophagus to the stomach. So it will block in the neck region, and this is a apradivarya virya vivarjaniyam. So it cannot be treatment, so it can be asadhya. Should reject this. Next comes Gilayuga. Mamsakilo gale dosher ego anego adava alparuk kritra uchvasaphi apyavakridim pradumulo gilayukaha. So in Gilayu also same, Mamsakilo gale, there will be a muscular growth in the gala region. Doshehi, it is caused by all the three doshas. Ego, anego, adava, alparuk. The mamsakila will be one or more. So ego, anego, mamsakilo. There will be muscular growth which is one or more, and in the neck region, and it is caused by all the doshas. Athava, alparuk, there will be slight pain. Kritra uchvasa apyava hrido. Kritra uchvasa, difficulty in breathing, apyava hrido, and also difficulty in having food. Prudumula, the root is strong. Gilayugaha, this disease is known as Gilayu. The root of the Mamsakila, muscular growth is strong. So Mamsakilo Gale, so in the neck region or throat region, there will be formation of a muscular growth which is ego or aneko. So one or more growth will be there along with which is having Pradumula, deep rooted, and Alparuka. The pain will be very slight pain will be there, and but the patient will feel difficulty in breathing and also in having food. So this is Gilayuga. So Grandir Gale tu Amalaga Asti Matra Stiro Alparuk Syat Kapharekta Murtim Samlekshede Saktam Ivakshanam Cha Sa Shastra Sadhyastu Gilayu Satnyaha. So Gilayur Gale. So Amalaga Asti Matraha. Grandir in Gilayu there will it's a formation of Grandi in the Gala region, which is the size of Amalaga Asti, the seed of Amalaga, and Stiro Alparushaha. So that grandi or that growth is Stira, and there will be slight pain. Alparuk Syat Kapha Rekta Murthim. It is caused by the vitiation of Kapha and Rekta. Samlekshede Saktam Ivashanam Cha. And samlekshede saktam ashanam cha. So the patient won't be able to eat food, and shastra sadhyastu gilayu satnyaha. This is the shastra sadhya vyadi according to Susro Samhita. Chikilsa gilayuscha abhi yo vyadi stamscha shastrena sadhaye. With the shastra we can treat this disease. So we have to remove that Gilayu using Shastra. This is according to Susro Samhita. Okay. In Ashtanga Hridaya, the treatment is not mentioned. Shadagni. Puri Mamsa Angura Vradaha Tivra Thrid Jwara Murtharuk Shadakni Nijida Vartihi Shadakni Va Adiruk Kari. So Buri Mamsa Angura Vratha Tivra Thrid Jwara Murtharuk Shadakni Nijida Vartihi Shadakni Va Adirukari. So Shadakni is a weapon. You can see here. So round with the thorns on the sides. So this is Shadakini. So it looks like a Shadakini. Puri Mamsa Angura Vradaha. Puri Mamsa Angura Vrada means it is surrounded with the Mamsa Angura. So there is a swelling. It is surrounded with a small Mamsa Anguras. Tivra Thrid Jwara Murtharuka. So there will be Tivra Thrid. There will be Tivra Trishna, Jwaram, and also severe headache. Murtharuka. Shadakini Nijita, that disease is known as Shadakini, and it looks like a Shadakini, the Shastra, so that weapon, and Adirukari, and it will cause severe pain, that is Shadakini. Varthir Khana Kanda Nirodhiniya Chida Adimatram Pishida Prarohaihi Nana Ruja Uchraya Kari Tridosha Jnea Shadakniva Shadakni Atsadya. So Varthir Khana Kanda Nirodhiniya. So there will be that will cause Kanda Nirodhana, obstruction in the throat. Chida Adimatram Prishida Prarohaihi Nana Ruja Uchraya Kari. There will be severe pain. It is caused by Tridosha, and this is Asadya Vyadi. Gala Vidradi. Vyapta Sarvagala Shikra Janmapago Maharujaha Pudi Puya Nipasravi Kshvayadur Gala Vidradi. Vyapta Sarvagalaha Sarvagala Vyapta Shikra Janmapago Maharujaha Pudi Puya Nipasravi Kshvayadur Gala Vidradi. So next is Gala Vidradi. In Gala Vidradi, Sarvagala Vyapta, it is spread in all the full Gala region. Shikra Janma Pago, and it will form also fast, and Paga will also become fast. Maharujaha, severe pain will be there. Pudi Puya Nipasravi, and Pudi Puya pus Puya purulent pus will come out. Shvayadur Gala Vidradi. There is a swelling in the gala that is known as Gala Vidradi. This is the abscess. So abscess formed in the throat region. So Vyapta Sarvagalaha. So this is Shwayadu. Gala Vidradi is a swelling in the Gala region, and it will spread and form very fast, and suppuration will also form, the Paga will also become very fast, and there will be severe pain, and along with that there will be discharge which is very purulent. Pus discharge will be coming out from the throat. That is Gala Vidradi according to Ashtanga. According to Susru Samhita, Sarve Galam Vyapta Samuthido Yaha Shofo Dujo Yatrascha Sandhim Sarva Sa Sarvadosho Galavidradistu Tasyeva Tulya Kalu Sarvajascha. So this is because of all the tridosha, visheshan of all the doshas, and in the Gala region there will be a swelling, samuthido yaha swelling, sofo, rujo there will be severe pain, and the sarva means all the tridoshas are involved in this condition. This is according to Susruta Samhita. So in Gala Vidradi, the Chikilsa is Vidradau Sravide Sreshta Rojana Tasha Gaidiheye Sarodra Padu Patanga Kanehi Gandusha Karshanehi. So Vidradi, in Sarva Vidradi lakshanas can be seen in Sannipadaja Vidradi lakshana can be seen in Gala Vidradi, like that Susradacharya mentioned. So Vidradi Chikilsa only can be given here. So Sravide, first we have to open the abscess and remove all the content. After that you can do Karshana using Sreshta, Rojana, Tasha, Gaidika, Rodra, Padu, Patanga, Kana and all. And also with all these dravyas you can make Kashaya and give for Gandusha. So Sreshta Adibir, you can give Gandusha. So Shastra, using Shastra, Vidradau Srastrena Sravide. So using Shastra you have to cut open the abscess and remove all the contents, and with this drugs you have to do Pradisarana or Karshana, and also with this drugs you can give for Gandusha also. Amarmastam Supakwamcha Bedayed Gala Vidradim. This is according to Susru Samhita. Amarmastam Supakwam. If it is Pakwa Avastha Bedayed Gala Vidradim. You can do Bedana in Gala Vidradi and remove the contents. So this is the Chikilsa of Gala Vidradi. Next comes Gala Arbuda. It is only mentioned in Ashtanga Hridaya. Jihwa Avasane Kantha Pakam Shvayadum Malaha Janeyanti Stiram Rektam Nirucham Tad Gala Arbudam. So here Gala Arbuda Jihwa Avasane. So in the end of the Jihwa and Kantad Avapakam Shvayadum Malaha Kantadau Apagam. So in the Kantha Pradesha Apagam, which is not causing any paga, there is a swelling. Shvayadu Malaha, it is caused by all the tridoshas. Janeyanti Stiram Rektam Nirujam Tad Gala Arbudam. Janeyanti Shvayadu, which is Stira, and Rekta Varna Nirujam, without pain and without paga, and that condition is known as Gala Arbudam. So at the end of the tongue and in the Kanda region there will be a swelling which is Stira, and also in red in color, which is not having any separation or any pain, and that condition is known as Gala Arbuda. This can be compared with any malignant growth in the neck region or throat region. Next comes Galagandha. Galagandha is also, it is only mentioned in Ashtanga Hridaya. This is the first, is telling about the Samanya Lakshanas or the types of Galagandha, and this can be compared with goiter. Goiter you all know, right? So this can be compared with goiter. Pavana Sleshma Medopir Galagantho Paved Behihi Vardamanaha Sakalena Mushkavat Lempade Atiruk. Pavana Sleshma Medobir Galagando Paved Behihi. So outside you can see Galaganda, and it can be caused by Pavana, Shleshma and Medha. So there is 3 types of Galaganda: Vadaja Galagandam, Shleshmajam Kabaja Galagandam and Petoja Galagandam. Vardhamanaha Sakalena Mushkavat Lambade Adirug. And if we are neglecting it, then by the time it will become Mushkavat Lambe. It will be long and hanging like Mushkaga. Mushkavat Lembe, and there will be Adiruka. There will be pain, severe pain also. So this is the Lakshana of Galaganda. So Pavana, Shleshma, Medobir, Belagando, Pavet, Behi. So 3 types according to Ashtanga. Only Ashtanga mentioned Galaganda according under Kanda Rogas. So that will be Pavana, Shleshma and Medha. And if we are after long time, it will cause it will grow bigger, longer, and it will hang like a mushkaga. Mushkage lambede. So first is Vadaja Galaganda Lakshana. Krishno Aruno Va Toda Atya Sa Vadad Krishna Rajiman Vrithastalu Gale Shosham Kuriyad Virasa Asyada. Krishno Aruno. So Krishno or Aruna Varna. So 2 colors, Krishna Varna or Aruna Varna Va Toda Atyaha, severe pain. Sa Vadad Krishna Rajiman. Also there will be black lines. Krishna Rajiman Vritha Talu Gale Shosham, and there will be Shosha in the Talu and Talu Pala region and Gala region. In Talu and Gala Pradesha there will be dryness, and Vidasa Asyatha, tastelessness will also be there. So that is the Lakshana of Vadaja Galaganda. The growth, what we saw, right? The growth outside can be seen, that will be black in color or Aruna Varna, red or black in color, and there will be severe pain. Also there will be black lines on this swelling, and in the Talu region and in the Gala Pradesha there will be Shosha, dryness, and also Virasa Asyada, so there will be tastelessness. So this is Vadaja Galaganda Lakshana, and the treatment for Vadaja Galaganda is Galagandaha Pavanajaha Swinnu Nisruda Shonidaha Tilair Bijescha Ledvoma Priyala Shana Sampavaihi Ubanaho Vrene Rude Pralepyascha Punaha Punaha Shigru Tilvaga Tarkari Gaja Krishna Punarnavehi Kala Amrida Arkamulehi Pushpehi Kala Karahadajaihi Egeshikan Vide Pishtehi Suraya Kanchigenava Guduji Nimba Kudaja Hamsapadim Baladvehi Sadidam Payaye Tailam Sa Krishna Deva Darubihi. So in Galaganda caused by Pavanaja, you have to do Swedanam, Swinnu, Nisruda Shonidam, and Rektamoshna can be given, and Tiler Bijaista Ledvoma Priyala Kshana Saimbai Ubanaha. Ubanaha Sweda can be given using these dravyas. Vrane Rude Pralepyascha, and if the Vrana is healed, then you can go for Pralepa Punaha Punaha. You can do again and again Pralepa using these drugs. Shigruadi Dravya, Shigruatilvaka Tarkari Gaja Krishna Punanava Kala Mridake Mulescha Pushpescha Kadahada Jaihi Ekeshineva Pishter Surya Kanchikenava. Mixed with all these dravyas, make into a paste and mixed with Sura or Kanchikena sour drugs, and you can apply it over that area, over that Shveda, over that growth. And also you can make Taila using Guduji, Nimpha, Kudaja, Hamsapadi, Beladvayam, Sadayed, Payayed, and give us a Krishna Devadaru Bihi. Along with Krishna and Devadaru, you have to prepare Taila, and you can give this for Pana, Payayed Taila. So for the patient you can give inside. Gudujadi Taila can be given inside. So in Galaganda, Svedana should be done, then Rektamoksha can be done, then Ubanaha Sveda can be given, and after the Vrana is dried, you can do Leba using these drugs, Shigruadi drugs, making paste and mixed with sura and kanjika. You have to make a paste of these dravyas and apply over that area. And thaila prepared with the gudu jadi can be given for pana. So this is the treatment for Vadaja Galaganda. Next comes Kabaja Galaganda. Stiraha Savarna Kantuman Shidasparsho Guru Kafada Vritas Chalu Gale Lebaha Kuriascha Madura Aseda. Stiraha, the shofa will be, the growth is stira, savarnam same color, kanduman there will be itching, shida sparsho if you touch it will be cold to touch, and vritha talu gale lepaha, and talu gale lepam kuriyada. So it will cause lepa, a patient will feel like something is stuck in his Talu Pradesha and Gala Pradesha. So Talu Gale Lepaha Kuriyascha Madura Aseda, and the patient will have Madura Aseda. In Vadaja there will be no taste only, here Madura Aseda. So stira, savarna same color, and there will be itching, and if you touch it will shida sparsha, guru heavy, and something is stuck in his talu or garla pradesha, you will feel like that, and also madura asida, sweet taste will be there in his mouth. This is kabaja galaganda lakshanas. And chikilsa is karthavyam kavaje apyedat sveda vilam vimlapane tu iti. So we have to do Shveda like how it is mentioned in Vadaja Galaganda. So same leba can be, same Shveda, that is Ubanaha Shveda can be given here also. Lepo Ajagandha Adivisha Vishalya Vishalya sa Vishanikaha Gunja Shugahwascha Palaksha Sharakalkedaha. With all these drugs you can apply lepa on that region. Mutra Srudam Hadaksharam Paktva Quadrava Pukpipeda Sadidam Vatsakadirva Tailam Sapadu Panjagaihi Kafaknan Duma Vamana Navanadimscha Shilaye. So, Mutra Srudam Hadaksharam Paktva Quadrava Pukpibeda. For Pana, we have to give Mutra Srudam, Gomutra, Hadaksharam, Paktva Quadrava Pukka. So, we have to prepare Kashaya, Paktva. So, we have to boil Mutra Srudam, Gomutra, Hadaksharam, and Kodrava, and Sadidam, Vatsakadirva, Tailam, Sapadu, Panchakaihi, and prepared Taila can be prepared with this, and Padu Panchaga also you have to add, and ask the patient to drink that, and Kabakna, Kavahara, Dhumapana, Vamana, and Navana can also be given in this condition. So Kavaja Galaganda you have to do Svedana like what mentioned in Vadaja Galaganda, and also Leba with all these dravyas can be given, and Taila prepared with the Gomutra, Hadakshara, Kodrava, and all Vatsagadhirva, all these things, and all the 5 levanas can also be added, and that Taila can be given for drinking, and Kafahara, Dhumapanam, Kavahara Vamanam, Navana, all this can be given. Next comes Medoja Galaganda, Medasaha Sleshmabad Nivrthayo, so Anuvidiyade, Deham Vrithascha Kurude, Gale Shabdam Swere Alpadam. So Medasaha Sleshmabad Nivrdeo, so Anuvidiyade, Deham Vrithascha Kurude, Gale Shabdam Swere Alpadam. With the Meda Kaleshma Vat Nivratayoho. All the Lakshanas of Kavaja Galaganda can be seen in Medoja Galaganda also. So Anubadi Idiade and Vrittir Hani Sleshmavad. So Meda Saha Sleshmavad. The Sleshmavad Lakshana can be seen in Medoja Galaganda also. Hani Vriddayoho. So Anuvidhiriyade Deham Vriddhascha Kurude Gale Shabdam Sware Alpadam. Here what will happen is the growth hani will become less or vriddhi, the growth will become more depending on the sharira. If deha is becoming vriddha, the patient is getting becoming thin, then this growth will also become thin. If the patient is becoming stout, then the growth will also grow. That is hani vriddhayoho, so anuvidhiryade deham vriddhascha. If deha is getting vriddha, then this galaganda will also become big, and if it is becoming hani thin, then this galaganda will also be small. Gale shabdaha sware alpatam, and swara will also get affected. Swara hani, the sound won't come properly. Swara hani will also happen in medoja galaganda. This is the lakshana. And chigilsa medo bhavi siram vidyed khafaknam cha vidim bhajeda asannadi rajaschevam pradar mutrena payeda. Asanadir rajaschenam pradar mutrena payed. So here you have to do Siraveda, and Siraveda can be given, and Kapakna Chigilsa, all the Kapakna Chigilsa can be given, and Asanadi Churna Pradar Gomutrana Payed. Asanadi Churna can be given in the morning time along with the Gomutra in Medoja Galaganda Avastha. So Medoja Galaganda, you have to do Siraveda, and also you can go do all the Kaba Galaganda Chikilsa, and also Asanadi Churna can be given along with the Gomutra in this condition. Ashantau Pajayitvascha Sarvan Vranavad Achareda. So all the Galagandas, if it is not coming down with this treatment, then you can go for Pajayitva or Padayitva. You can cut open that, and Vranavad Chigilsa can be done in this condition. So Vranavad Chigilsa can be given in the Galaganda. So this is about Galaganda, Lakshana and Chikilsa. Next, the next disease, the last disease in Ashtanga Hridaya is Swarakna. Sleshma Rudha Anila Gadim Shushka Kanto Hrida Swaraha Tamyan Prasaktam Shvasidi Yenascha Swaraha Anilat. Sleshma Rudha Anila Gadihi Shushka Kando Hridaswaraha Tamyan Prasaktam Shvasiti Yena Sa Swaraha Anilat. So Swaraha is Swara won't come. There is a block in the sound. So it is the disease affecting the larynx. So it's completely not coming. Then there will be paralysis of the larynx. So or laryngitis condition and all, there will be Swaraha, sound won't come. So Sleshma Rudhva Anila Gadihi. The Anila Gadi is blocked by the air passage is blocked by Sleshma Kapha. Shushka Kande, and will cause dryness. Shushka Kande Krida Swaraha, and Swara is not, Swara is obstructed. Tamyan Prasaktam Shvasidi Yenascha, and also the patient is not able to breathe properly. So that condition is known as Swaraha. And Gadi, so all the Indriyas, Tamyan Prasaktam, so all the Indriyas will become lazy. So that all the tiredness will be there. According to Susra Samhita, yo adipradamyan shvasidi prasaktam Phinnaswaram Shushka Vimukta Kandaha Kafa Ubagdigdeshu Anilayaneshu Nyeyaha Saroga Shvasana Swarakna. Swarakna. So Adipradamyan Shvasadi, very difficult to breathe. Phinnaswaram, the sound broken sound. Shushka Vimukta Kandaha, and dryness. Kafa Ubadigdeshu, it is caused by Anilayaneshu, the air passage is blocked by Kapha. Nyeya Sarogaha Shvasana Swaraknaha. That disease is known as Swarakna. So according to Susruta Samhita. And there is no treatment mentioned for Surakna also. And Adijihva is mentioned in Susra Samhita. It is only mentioned in Susra Samhita. In Ashtanga Hridaya it is mentioned in Jihva Rogas. Jihvagra Rubaha Kshvayaduhu Kafatu Jihva Prabandhobari Rekta Misrat Neyo Adijihva Khalu Rokha Esha Vivarjayeda Agada Pagamenam. So Jihva agra rubaha kshvayaduhu. Jihva agra ruba looks like Jihva agra ruba. There is a swelling. Kapha too. It is formed by kapha. Jihva prabandha upari rekta misrada. Though kapha mixed with kapha getting vitiated along with rekta will cause this disease. Kapha Jihva prabandha upari. So like it looks like the tip of the tongue, and it is seen in the ubari above the tongue. Neo adijihva, that disease is known as adijihva. Khalu roga esha vivarjaye. This disease we have to reject because it is a asadhya vyadhi. Ubajihvagascha abhi sadayed adijihvikam. So ubajihva chikilsa can be given in adijihva. But in Ashtanga Hridaya, it is mentioned adijihva is like a tongue. It is formed under the tongue, but in Susra Samhita it is mentioned as it is the disease swelling like a jihva, tongue like swelling is seen above the tongue. So like jihva agre ruba, it looks like the swelling looks like the tip of the tongue itself, and it is seen on the above the tongue. That is according to Susra Samhita. And this can be compared with the epiglottitis. So epiglottis is so the inflammation of epiglottis can be seen like a tip of the tongue in the throat region. Maybe because of that Susritacharya has mentioned this under the Kanda Rogas. Then the next disease mentioned in Susruta Samhita is Valasa. Galetu shofam kurudaha pravrtho sleshma anulo shwasa rujopamam marmaschidam dustaram etadahu balasa sapnyam nipuna vikaram. So galetu shofam kurudaha pravrtho sleshma anilau shwasa rujopamam. So in gala there will be shofa. Sleshma anulo shwasa rujo pamam. It is caused by sleshma and anila, and shwasa rujo pamam. There will be pain and difficulty in breathing. Marmas chidam dustara medat, and the pain will be like breaking the marma only. The rujopamam marmas chidam, the breaking the marma, how the pain will be, it will be like that. And dustara medadahu, and it's very difficult. And balasa sapnya nibuna vikaram, this disease is known as balasa. So there will be a shofa in the gala region which is caused by sleshma and anila, and the difficulty in breathing will be there, and a severe pain, it's like breaking the marma, like that pain will be there, and very difficult for the patient, and this disease is known as balasa. And treatment is not mentioned. So asadhya disease. Mamsadana pradhanavan yahakshvaiduhu sukashto galo barodam kurude kramena sa mamsadanaha katido avalambi prana pranut sarvakrit vikaraha. Pradhanavan yahakshvaiduhu, there is a big swelling. Pradhanavan yahakshvaiduhu sukashto gala ubarodaha, it will cause the obstruction of the gala only. Kurude kramena, slowly it will obstruct the full gala. Sa mamsadhanam kadido, that disease is known as mamsadhanam avalambi prana pranut sarvakrit vikaraha. Prana pranuta, so it will dangerous for the prana only, and it's this disease is known as mamsa dana sarvakrito vikaraha. So this is also a growth which is obstructing the throat, and it hangs. Avalambi means it's hanging loose, and prana pranut obstruct the life, that means it obstructs the airways. Sarvakrito vikaraha, and this is produced by all the doshas. This is mamsa dana. So pradhana one, there is a shvayadu, a big shvayadu in the gala ubarodham, maybe some malignant growth, and kurudoe kramena, it will grow slowly, and this disease is known as mamsa dhanam. Avalambi, it hangs loose, and prana pranut obstructed the air, and sarvakrito, it is caused by all the doshas. Next comes the disease mentioned in Susra Samhita is Vidari. Sadahastodam shvaidu sarektam andargale pudir vishirna mamsam pittena vidyat vadane vidarim parshve visheshat satu yena shede. So dahatodam shvayadum sarektam andargale pudir vishirna mamsam. So there will be daha and toda, burning sensation and pain. Shvayadum, swelling. So swelling will be there in the gala region, along with there is a daha and toda, and rectum andargale. Sarektam andargale, the redness will be there. Pudi vishirna mamsam, and there will be separation of the mamsa in the gala region, and pittena vidyad vadane. This disease is produced by or caused by the pitta. This disease is known as vidarim parshve visheshadam satu yena shede, and this is specifically seen on the side of the gala, side of the neck region. So this is vidari. So this is a disease caused by, so maybe abscess or a cyst. Most probably it's an abscess, because there will be daha, toda, and redness also will be there, and pudi vishirna mamsa, there will be separation of the mamsa. So it may be an abscess, formation of abscess in one side of the neck. So this is vidari. So no treatment is mentioned. So this is all about the Kanda Rogas. Hope you all understood all the Kanda Rogas. Thank you.